Well, good morning, everybody. Well, I guess it's sort of not morning anymore. It's noon. Anyway, hi, everybody. This is Dr. Sonia McGowan. I'm the owner of the Covenant Pediatric Wellness Center and Covenant Pediatrics here in Jefferson City. And we are together now for our November webinar where I will be talking about low cholesterol. So, cholesterol is fuel for the brain. It's part of what makes your brain happy. And it's very commonly low in complex kids. And when I tell parents that, or I tell other professionals that, they often look at me like I'm crazy because in our society, we've been taught the lower your cholesterol, the healthier you are. And it's just not true. And it's especially not true for complex kids. So let's jump in. If you have questions, put them in the sidebar. There's a Q&A section, and I will answer those as I can throughout the lecture. All right, so one of the main things that we repeat ad nauseum here at Covenant is the why matters. So kids don't just have bad behavior for no reason. Kids don't just lose skills or have a regression for no reason. Kids aren't constipated or can't sleep for no reason. When we dig in and we know what to look for, when we know the right test to do, we can figure out the why behind behavior. And that is really the basis of everything that we do here, because there are no bad kids and there are no purposeless behaviors. And so what we have to do is look for the why behind behaviors. So I've been doing this a really long time. I started working with adults with autism when I was in college. And, that was a long time ago. I was the deputy director for the Judavine Center for Autism out of St. Louis for many, many years. So I literally have seen it all. And everything changed for me in 2011 when I went to what was then known as a DAN conference. And DAN stands for Defeat Autism Now. It has since morphed into the MAPS program, the Medical Academy of Pediatrics and Special Needs. And so when I went to that conference it wasn't 2011, it was 2001. It was right after 9/11. So when I went to that conference, I had always been taught before that autism was genetic, autism was purely behavioral. There was even a point in time when the professionals said autism was the mom's fault, right? Because she was not a good parent. And so, of course, I knew that part was nonsense. But when I went to this conference, I learned that there were environmental factors that could influence a child and their behavior. So things like food allergies, things like heavy metals, things like toxicants and pollutants. And once I learned that, I was absolutely hooked. And so a few years later, after I had my kids, I decided I needed to be a DAN doctor. So I went back to school, became a chiropractor, and eventually became a DAN slash MAPS doctor. So I've been at it a long time, and I care very deeply about not only kids with autism, but I've sort of expanded that language into saying complex kids, because it used to be just only kids with autism. And now it's just so much more than that. So we've broadened that phrase a little bit. So I am lucky enough to be married to my soulmate, Shannon. He is a newly retired CPA. He's newly retired, and we have a newly empty nest, sort of. So we have Libby, who is 22. She lives in Kansas City. She's a musician, and she is incredibly talented. So she's, again, 22. She's actually applied to the UMKC Conservatory of Music, so we're waiting to hear about that. And then we have Rowan, who is 20. He is a junior at Millikan University. What Libby can do with music, he can do with textiles. So he's a great designer, and his major is theater costume design. But when he was a little guy, and this is a picture of him when he was little in the barber chair, covering his ears. He had a little bit of a rough beginning. He had some behavior challenges. He had some issues around aggression and self-injury. He was covered in eczema. He had terrible diarrhea. He was nonverbal for most of his toddlerhood. And I'm so grateful that I went to that DAN conference only 4 years before he was born, because that really equipped me to understand that there was more to his behavior. And once we got some things figured out, we determined that he had a terrible candida yeast overgrowth in his intestine. He had some nutrient deficiencies. He had some food allergies. And so once we got all that figured out, literally within hardly any time at all, he became indistinguishable from his peers, and he still is. You would never know that he had a rough beginning. So we had quite a struggle figuring out what to do for him and how to help him. And I just remember thinking to myself, if I ever am in a position to help other moms not feel as alone as I did then, that I was going to do that. And so everything that we are here at Covenant really stems from the struggles that we had getting Rowan the help that he needed. So, all right. So we offer a lot of things here. So my real passion, as everybody knows, is complex kids. And so we do a lot of lab testing. We really focus on the neurological side of chiropractic. We do functional nutrition. We also have a pediatrician on staff. So Dr. Hannah Strong is gaining more and more experience with complex kids, autism, PANS and PANDAS every day. But she, primarily offers standard pediatrics care. We are the one place in our county who will accept kids of parents who have strongly held beliefs around vaccination. So whatever a child's vaccine status, we are happy to serve them. We are still taking newborn patients right now. We have a long waiting list for other pediatric care. So we'll keep you posted on all of that. So we also do a lot of work around oral restrictions, so tongue ties, lip ties, and then we do prenatal and pediatric chiropractic as well. All right, so let's talk about our topic today. So cholesterol. Cholesterol is a waxy, fat-like substance. It's made by the liver. It's also in some foods. So you think about eggs and, organ meats and things like that. And so cholesterol is not bad. Cholesterol is good, or else our body wouldn't make it, right? There are different types of cholesterol. So if you've ever had a lipid panel of your own, you've seen how it's broken down into like LDL, HDL, things like that. So some people say, oh, that's your good cholesterol and that's your bad cholesterol. None of it necessarily is bad. It's all needed. It all has a job. So cholesterol travels through the blood on special proteins called lipoproteins. So anytime you hear that prefix lipo or lippy, that's going to be related to fat. So LDL stands for low density lipoprotein, sometimes called the bad cholesterol. High levels, some people believe, may promote cardiovascular problems. And then we have HDL. That's the high density lipoprotein, sometimes called the good cholesterol. So high levels reduce the chances of cardiovascular issues. So in theory, you want your HDL to be nice and high. Okay. You'll also see on a lipid panel that they mention something called triglycerides. And so this is a type of fat in the blood that is used for energy. We really don't want it to be too high, but it is an important piece of your biochemistry because it does give you energy. So today we're talking about total cholesterol. So that includes both HDL and LDL. So again, often you hear that cholesterol is bad. It is not bad. It's actually essential for the brain and the body to function. So some of the things that cholesterol does, it maintains the integrity and the fluidity of cell membranes, especially in the brain. So when you think about a cell, there's a cell wall, right? And it has to be somewhat rigid. It has to be not stiff, right? But also not too floppy. You have to have just the right makeup of that cell wall so that good things can get through the cell wall and bad things can get out. And so if you don't have enough cholesterol, which is a building block of that cell wall, then your cells are going to be leaky, right? You're not going to be able to have that integrity that lets good things in and bad things out. Cholesterol is very important for brain development and function. It also is a very important component of what's called myelin. So myelin is think about it like insulation around your nerves. And the myelin is what lets those nerve impulses move very quickly. And so it also is an important part of the synapses. So that's where nerve cells meet each other. Okay. And so if you don't have an adequate amount of cholesterol, then you're going to struggle with brain development, brain function, myelin, and other nerve functions. Cholesterol is a building block for human tissues. It's also a precursor for growth and sex hormones. So things like testosterone, estrogen, cortisol all need adequate cholesterol to then be made. And so a lot of times what we hear from families is, oh my gosh, I dread puberty because my mom friend said her son went through puberty and his behaviors got so much worse. I also hear a lot about dysmenorrhea. So, teen girls who might have some complex needs talking an awful lot about, PMS is terrible, cramps are terrible. And when we look deeper, in almost every case, we find that cholesterol is very low. And so we try to be proactive whenever, we're working with a child who is approaching puberty. We're really mindful to look at that cholesterol level, make sure it's high enough so that their entry into puberty can be a little bit easier. Now, on a side note, we do work with complex adults too. So, neurotypical women, men who might be having trouble with digestion or sleep or hormone balance or fertility or whatever it might be. And we often find the same situation with them. So very often we'll see adults will check their lipid panel and their cholesterol is very low. Once we get that fixed up, then a lot of their complaints will go away. All right. So cholesterol is also an important component of hormone receptors for things like GABA and serotonin. Cholesterol assists in the bile production, which happens in the liver. It also helps make vitamin D. It also helps with immune system regulation and inflammation. So it's very important. And another aside, when we do standard labs on kids, what I have seen over my many years of doing this is a correlation with low cholesterol, the child also having low fatty acid levels, so particularly omega-3s, and they tend also to have low vitamin D. Those three things go together. So low cholesterol, low vitamin D, low fatty acids. It is absolutely probably 95% of kids I look at have that triad of findings. So very, very important that we look at that. So what levels are considered normal? So I want in the kids and adults I see for their cholesterol to be at least 200, their total cholesterol to be at least 200, as much as 225 is good as well. But this is what is considered normal. So anything less than 200 is great. For your LDL, less than 100. For HDL, the good guy, we want it 40 or higher, and then your trigs to be less than 150. But again, ideally, functionally, we want that total cholesterol to be between 200 and 225. All right, so the lipoprotein transport system. So we talked about LDL, HDL, and triglycerides. So the LDL transports cholesterol to the cells to be used. The HDL helps remove excess cholesterol from the bloodstream. And then the triglycerides store energy and work alongside cholesterol for cell function. So as you can see, all of it's absolutely necessary. Nothing is inherently bad here. You just want to have the right levels and ratios. All right, so what levels are considered low? So I keep a little chart right next to my desk that looks very much like this so that when I'm analyzing labs, I can know exactly where the child stands. So low cholesterol is, 160 to 130. Moderately low is 130 to 100. Very low is less than 100. I think one of the lowest I've ever seen was in the 50s. I've seen lots of kids in the 70s, in the 80s. And so, again, our target is 200 to 225. And so if a child is very much lower than that, we're going to intervene. All right. So cholesterol is important for kids. They need more cholesterol for brain growth and immune function than adults do. And in a perfect world, in an ideal situation, the body would make all the cholesterol that it needs. But in complex kids, they have they're complicated, right? They have some issues that sort of get in the way with that, and we're gonna talk a little bit more about those. So, why would cholesterol be low particularly in a child, but in anyone? Often it's intestinal malabsorption. And this is another thing that we test very consistently in complex kids. So one of the main tests that we do is a urine test, and there is an entire section of one page that breaks down what's going on with their digestive system. So it will rate their malabsorption with two different markers. So malabsorption can be due to things like dysbiosis. So maybe there's a bacterial or a yeast overgrowth. Sometimes kids aren't great digesters. They don't have enough digestive enzymes to break the food down before it makes it to the small intestine. And so malabsorption, it's very, very common in complex kids. So this could be a reason why the cholesterol is low, because they're just not absorbing it from the foods that they're eating. Another reason that cholesterol might be low in a child is deficiencies. So again, this is another thing that we consistently see in kids. 99.9% of kids we test have pretty significant deficiencies. We look at antioxidants, we look at B vitamins, minerals, and fatty acids. And if a child comes back mostly normal on that page, I'm always very surprised. So generally, 99.9% of kids have pretty significant deficiencies. And so when this happens, how it relates to cholesterol basically is that there's a lack of cofactors that the body needs to then generate cholesterol in the liver. Sometimes it's a transport issue. So our kids are not good transporters. They're not good at getting things to where they need to go, and they're not good at getting things out. So not good either way. And so often they just have poor cholesterol transport. Another thing that will influence our cholesterol level is inflammation. And again, these are kids who generally have a high systemic level of inflammation. Infections will also influence our cholesterol levels. So when a child, so remember, cholesterol is a big part of the immune response. And so if a child has an infection, it's going to increase the demand for cholesterol. And many of our kids have lots of hidden infections. So we will see things like high strep antibodies. We'll see viral antibodies, mycoplasma. And so again, now that we know that this is a pattern with kids, it's something that we test very consistently. High levels of stress will lower your cholesterol levels, as will mitochondrial dysfunction. And, all of these are issues that I've talked about through the year in different webinars. There is a webinar specifically about mitochondrial dysfunction. You can find it on our YouTube page if you want more information. All right, so some other reasons why cholesterol would be low. Selective eating. So most complex kids aren't great eaters, right? They're super selective. They only like to eat certain things, and generally it's not things that are high in fat or high in cholesterol. Sometimes it's a genetic issue. There is a condition called Smith-Lemli-Opitz syndrome that creates a mutation in the last step of cholesterol synthesis. And so that's not super common. I've never seen it in my practice, but it is out there. So there are some genetic causes for low cholesterol. And so when we talk about cholesterol specific to autism, there was a study by Harvard University that found that people with autism are twice as likely to have abnormally low lipid levels. And other studies suggest that they might be 3 times more likely to have low cholesterol. So it's a very important thing. And even not every kid who comes to me has a diagnosis of autism, right? That's why I say complex kids. So I don't only look at cholesterol in kids with autism. I look at cholesterol across the board, no matter what their diagnosis is. So in my practice, this is such a common phenomenon across complex kids, again, not just kids with autism, that now this is a standard part of my workup. We do a lipid panel on pretty much all kids who come to us for functional nutrition services. So what can low cholesterol look like in a complex kid? So we will see all of these things in one kid or another, right? So we see sensory issues. It can be sensory seeking. It might be sensory avoidance. We will often see failure to thrive. So these are kids who might have that diagnosis or just sort of have that look about them that they just, aren't thriving. They're not, they're doing their best. They're trying to survive and thrive, but they tend to be small and thin and pale. We see a lot of irritability. We will see language delays, poor sleep, a lot of behavioral issues. So obsessive thoughts, compulsive behavior, aggression sometimes, self-injury. We'll see kids who are super moody. We will sometimes see things like poor focus, low muscle tone, social skills challenges. And when you just look at this, it looks very much like just a profile of a child with autism. We also, again, see mood issues. So a lot of depression, sometimes suicidal ideation. Sometimes they get a mental health diagnosis like bipolar or schizophrenia. We will often see a late onset of puberty. Sometimes we'll see menstrual symptoms as well, like I talked about before. Remember that cholesterol is a part of your immune response. So we very frequently will see immune dysfunction. We will see constipation. We'll see also their poop often looks kind of slimy, oily. We will see gallbladder issues because the gallbladder and the liver work together to emulsify fats. Sometimes even in older people will see things as extreme as cancer or substance abuse. So when we test for cholesterol, it's a blood test. We can do either a full lipid panel or we can isolate it to a total cholesterol only. It's a very inexpensive test. If you pay cash for it with me through LabCorp, it's like $5 or $7. Very, very reasonable for a great deal of information that it gives us. So if we want to increase cholesterol levels, we can do it with the diet if the child is not a particularly selective eater. These are the foods that are higher in cholesterol. So eggs, dairy, red meat, shellfish, certain oils, certain things that most kids aren't going to want to eat, like sardines and organ meat, right? I'm an adult and don't want to eat those things. But those, sometimes kids love it. So that's, if they do, that's great. Some challenges to address cholesterol via diet is many of our kids are very selective eaters, right? They're not going to have anything to do with shellfish or sardines. And sometimes we have food allergies and sensitivities that get in the way. So we have a lot of kids who have dairy allergies or sensitivities or egg allergies and sensitivities. So that really limits how well you can address it with diet. So one of the things I really rely on in my practice is a supplement from New Beginnings Nutritionals called Sonic Cholesterol. So it was created as an option to safely raise those cholesterol levels. It's the only product out there that does this, and it's only available through New Beginnings Nutritionals. It does require a physician authorization. So you can't just go to New Beginnings and order it. You have to be working with a physician who is monitoring the cholesterol levels because, too much of anything can be not a good thing, right? So we need to make sure that Sonic Cholesterol is warranted based on those blood levels. And we monitor that ongoing. So I don't just recommend Sonic Cholesterol one and done forever, right? So every 3 months or so, we're monitoring those levels of lipids in the blood, and then we adjust the dosage based on that. So in my clinic, what I see is incredible results when we use sonic cholesterol for kids who have low cholesterol levels. So, I mean, I've had kids who were, very aggressive, very self-injurious, weren't sleeping, weren't talking, could not control their behaviors, lots of compulsiveness. Life was just really hard. And as we added sonic cholesterol and we got those levels up to where they needed to be, 200 to 225, we generally will see many of those behaviors either improve or resolve. So it's a really big deal. I've even seen, particularly if we find that triad that I talked about of the low cholesterol, low fatty acids, low vitamin D, when we look at all three of those and address each one, that's when we really see major improvements. I've even seen kids who had warts, for example. I remember one kid, his knee was and feet were just covered in warts. And within days of addressing, vitamin D and other things that he needed, the warts literally just fell off one day. So nothing surprises me anymore based on some of the things that I've seen with kids. So if you're concerned about your child, and your gut is telling you need to have this checked, definitely do that. But it can be a challenge to find a practitioner who understands cholesterol and its relation to autism, complex kids, puberty, mental health, etc. So, look in your area for sure. You can always go, there are a couple of directories that might help you, particularly the MAPS physician directory. It's at medmaps.org. I'll put that in the chat. So medmaps.org, they maintain a physician directory. And so you can search via your state or your zip code to find a practitioner in your area. If you're in Missouri, I am always taking new patients. I don't think I will ever stop because the need is so great. But I do have years of experience using sonic cholesterol with really good results. So again, we're always taking new patients. To schedule, just contact Brittany at covenantwellness.net. And we can get you fixed up. And if we're not in the position, if we're not a good or right fit for you, we can help guide you to the next right thing. So I'm going to give you a couple minutes to drop any questions that you have in the Q&A box. In the meantime, this is something that I do every month, generally first or second Friday of each month. I do a webinar on a topic specific to complex kids. Once that's done, and if you've registered for it, you can have access to the replay so you can watch it anytime. We house all of those replays on a website that we maintain called thewhymatters.net, and I put that web address in the chat for you as well. So there you will find all previous webinars that I've done, and we also publish a blog twice a month, so all of our blogs live there too. The other thing that you can do is go to our YouTube channel. So if you go to YouTube and then put in at Covenant Wellness, you will find us, and there we have all of our webinars. We have any sort of Facebook Live event that I tend to do monthly, so you can watch any of that content that we produce every month. So next month in December, I'm doing kind of something a little bit different than I've ever done before. So the title of it is 2025 in Review, the Science and Hope Behind Recovering Complex Kids. So I'm going to sort of take everything I've taught you over the course of 2025, and we're going to put it all in one webinar to sort of connect all those dots together. So that will be December 12th. Should be at 9 a.m. Generally, I do it at 9 a.m. Today was just a day, so it needed to be at noon. So be sure to join us for the webinar on December 12th at 9 a.m., where we talk about, sort of wrapping up the whole year and all of the topics that we have talked about. So there we go. That's our contact information. We're here in Jefferson City. You can email me anytime. If you're interested in scheduling, the best way to do that is to email Brittany at Covenant Wellness .net, and I put her email address in the chat as well. So she is definitely the gateway to me. So if you have questions or interested in scheduling, just let her know. We also, again, have two other chiropractors. We have Dr. Maddie Lehman. We have Dr. Lacey Mays. Both are pediatric chiropractors. Also, adult chiropractors as well. They're certified in prenatal chiropractic. And so whether it's for your child or for yourself as an adult, we have people who can take good care of you here. So if you ever need any more information about our practice, just go to our website, covenantwellness.net. So there we go. That's low cholesterol in a nutshell. If you have any questions at all or any worries about your child, definitely reach out and we can help guide you on that. So looks like we have no questions. So I'm going to let you guys get on with your day. Again, you can rewatch this anytime on any of our platforms. Thanks for coming today. And if you think of questions once we hang up or we disconnect, you can always email me, Dr. Sonia at covenantwellness.net. All right, guys, have a good weekend. Bye-bye.